Thank you to the Asia Society for hosting this event today and for inviting me to help frame our conversation about what global education can learn from global health. So I think that the hypothesis that we're exploring here today is that investment in a stronger global ecosystem for education that produces high-quality global public goods would support country-level education reformers to achieve better education outcomes. So before we dive in, I want to make sure we're all on the same page about the definitions we're using, because we're throwing around these words ecosystem and global public good. So let's see how we are going to be defining those. Now, the global education ecosystem we're defining as the broad constellation of public and private institutions that facilitate the adoption of effective approaches and build local capacity to deliver high-quality education across geographies. Got that? Great. Okay, so we're going to move on to the even simpler definition of global public goods, which we define as knowledge and tools that are non-rivalrous, non-excludable, have positive externalities, and are more efficiently produced collectively. Global public goods are available across multiple countries, and they can include research, standards of practice, and measurement tools. And I think we consulted our economist friends while we were developing this definition, so it's all good. So I have actually spent my career focused on health system strengthening, first domestically here in the U.S. and later globally. But I now lead Results for Development, which is focused on supporting country change agents to improve their health and education systems. So in my job day-to-day, I'm thinking a lot about what the two sectors can learn from one another. And I've witnessed some of the transformative power of investing in global public goods. Starting back in 2010, I was involved in creating a network called the Joint Learning Network for Universal Health Coverage, which now includes 27 member countries. And within this network, we bring together policymakers and government practitioners who define their challenges themselves and then co-create global public goods for how to solve those challenges together. And this has been a remarkably effective approach that is now engaging people at all levels of government across 27 countries. I'm now working closely with my colleague, Amy Black, who's here today, who leads our education group, to see if we can replicate something like this for policymakers and government practitioners in education. Now, to start off our dialogue today about what global education can learn from global public health, I want to start with a striking statistic from an Education Commission paper that was written by my colleague Nick Burnett at Results for Development and also Marker Schaeferhoff at SEEK. Now, they found that just 3% of official development assistance in education went to global public goods in 2013, which amounts to just about $242 million. By comparison, 21% of ODA in the health sector is spent on global public goods, which amounts to $4.7 billion. This is pretty striking and massive. This is a 20 times differential. And this has actually made a difference in health. It's created a robust global ecosystem for health, which Ariel and I are going to talk about in just a moment. There was a study done on the global health ecosystem a couple of years ago that found that 100 new robust institutions have been created in the past several decades, which do everything from cost-effectiveness analysis to determine which interventions work best, to provision of technical assistance to countries, to measurement of outcomes, to practical peer-to-peer learning networks like the one I mentioned. And these investments have led to big gains, which I'm sure many of you have heard about. Over the last several decades, the number of deaths due to malaria, HIV, AIDS, and TB has dropped dramatically. And very strikingly, the number of deaths of children under age 5 has been cut in half since 1990. This is estimated to translate to about 122 million children whose lives have been saved over the past 25 years. So I think why we're here today is now that we've gotten more kids surviving, we want to have more of them thriving as well. And that's why we're here to talk about education. So in order to explore more about this and how global health has created this ecosystem, which has been so successful, I'd like to invite my friend, Dr. Ariel Pablos-Mendez, up to the stage. And I'm going to introduce him from here.
Good afternoon.
So Ariel is a good friend of mine. We've been working together for a number of years. He hails originally from Mexico. He's a physician who's currently practicing and also teaching at the School of Public Health here in Columbia in New York. But I like to think of him as the father, if not one of the fathers, of the global universal health coverage movement. He worked at the World Health Organization for a number of years. He led health at Rockefeller, and he also was the head of health at USAID in the Obama administration. So he has been a key player in developing this global ecosystem. So we're so happy to have you here today, Ariel. Can you start out maybe by telling us a bit more about some of the characteristics of this global health ecosystem that might be helpful to our education colleagues to think about?
Sure. I mean, we have been living through what I call a golden era of global health. And when I say that, is not to feel jealous, but it has not always been so. And it might not continue to be so. So that there are factors that can shape an agenda, that can shape an opportunity. And I think that that's important to keep in mind. I think in global health, like in education, and we share so much, and we should learn more from each other, not just from health, because we share a lot of the social dimensions at the national level, and because of that, how we construe it at the global level. We, of course, has been, for us, compassion has been key, right? Saving the lives of children. And that has been a powerful agenda. AIDS was also compassionate, but it was so much more powerful and political, and in a way was an accident of this generation, right? It's not something of the ongoing problems, right? We were just talking, either were the equivalent of pandemics for education, and you certainly get also the fear factor and so on. But advocacy was paramount, and the mobilization that AIDS particularly brought was so important. And fear, we don't need to really increase fear. We were paralyzed when Ebola happened, paralyzed. Nobody wanted to volunteer. So fear is very real and very powerful in health. So there's things that are pertaining to health, but again, the social dimensions, the aspirations are something we do share. The vision that we can end preventable child maternal death, the economic arguments, you have so many, probably in a way more than in health, although we do our best with the economic arguments. Those are very important to mobilize policy. In the end, is the power of ideas. And I was just telling Wendy that indeed, for example, Teach for America, wonderful idea. You need those ideas that capture a dimension of the problem, the solution, and the mechanism. And the Joint Learning Network was one example. R4D itself was an example of the think tanks we also needed to advance our agenda.
Great, thanks, Ariel. When we were talking about this the other day, you mentioned to me something about the concept of open source anarchy. Yeah. And I think in part, there were some really important investments a decade or two ago to really understand what actually worked in global health, the interventions that worked. And that led to more donors coming on the scene and funding more of the ecosystem. But tell me more what you mean about open source anarchy.
The field of global health, historically, we used to be called tropical medicine in the first half of last century. With the end of European colonialism in the 60s, we became international health. And it was an era where the UN was established, WHO was established, UNICEF. It was the UN era. Governments, many nation states were new at the time, and there was not a lot of money, but there was a lot of confidence as to what the world needed to do. And that changed too with the end of the Cold War. In the 90s, we became in global health. And it was the era of liberal economics, and it was globalization, it was decentralization, it was privatization, and so on and so forth. And that opened up the space for an explosion of NGOs and coincided again with AIDS and the efforts to address this. And I think for us, that for the people who were in WHO, they thought the floor moved under their feet because they were no longer the paramount organization. Suddenly, I mean, it is, but suddenly there were so many players and many of them were getting money on their own. It became confusing. Some people, indeed, Debbie Fiedler coined the term that you just use. And I think that the open source anarchy was seen with concern. We can still coordinate our efforts. And we sort of couldn't, except that the MDGs gave us the marching orders. So having the policy framework set right and inviting open participation from people with ideas and energy and angles. It's almost like a marketplace for, in this case, our missions, invited so many of them. And there was almost like a tacit agreement among all the players not to criticize each other. Most of the efforts were vertical as opposed to going for the system. And even within the HIV community, treatment will not be at the expense of prevention, and will never set one against the other, or HIV against TB. So there were so many players doing different bits and pieces, all agreeing that it was important, never doing at the expense of the other, and it's never perfect. But remember, things are fungible. There are many other ways to make things right, because sometimes the verticals can be too heavy for one corner or the other of the world. But that was important. I think very importantly as well, as you pointed out, there was an investment in global public goods. And I have to say, I believe that you need a global architecture of some sort, but it has to be soft touch. And then you do need a lot of global public goods. The efforts of the last 20 years in global health have been very grounded, but with global public goods, I believe global public goods will become more important in the future for all of us, and that will mean normativity. The Tobacco Convention was very important for us. Many other efforts, initiatives, R&D, innovation, simple solutions, how to scale up big-time solutions in countries and show. But one of the things that were, in my view, very, very important has been a measurement. And so the measurement, demographic health service, national health accounts, they have been able to, and then we have all these other players that came with great ideas how to organize the data, how to present the data, and it's been really so enriching and allowing us to reach and convey the case for the problems and the solutions.
So how do you feel like there are all these different global public goods that have been created? You mentioned a few of them: normative standards, evidence about what works, good measurement to understand what is working in different countries. How have those ideas actually translated to countries, would you say? And I know there's not one way, but can you think of a few ways that that those standards and evidence have gotten into practice in countries, and how has the ecosystem supported that?
Well, of course, normativity doesn't happen in a vacuum. It has to be linked to technical assistance. It has to be linked to local capacity and resources. And those things have been working more or less. I think that we have been impressed by the progress in many countries. Ethiopia, fantastic work in health. As you know, you don't have to be very rich to accomplish a lot. And so I believe that that progress has to be grounded. One thing that is important, maybe is the point to mention, that you mentioned universal coverage. And universal coverage, like Teach for All, we had Health for All back in 1978, big ministerial conference. So big ministerial conference with a purpose and a way to do things was very important. But what makes it possible now, unlike the 70s, when it was about the UN and the governments and there was no money, now there's a lot of money in the countries. And so this is very important, and I think education also. For us, the private sector, there's always a little of ideology in the public health community. In global health, we have been more open and embracing the private sector and lots of public-private partnerships, in part because of the era. And half of the provision on the ground is already private. So that's very important. But the resources that private resources dwarf ODA in the last 20 years, but also now those resources are dwarfed by domestic, public, and private resources. So beginning to think how to link the global thinking and catalytic leverage to change the systems with local resources is clearly the way to go. And what that means for those who were, like myself, were donors, and is our dollars will be diluted in country. In India, less than 1% of the total health expenditure is ODA. So the Minister of Health might not even pick up the phone when I call all that. He did. But meaning the value of my dollars is greater at the supranational. And making that clear, that investment in regional and global arrangements for global health security in our case, arrangements for normativity, arrangements for R&D and innovation, measurement and so on and so forth, is paramount. So the resource landscape has changed from 20 years ago. And then I finally will say, because USC is the universal coverage agenda that people thought it was crazy 10 years ago, and now it's G7, G20, UN, and SDGs, is because there is that new economic possibility, but also it coincides with a shift in the political economy. If we move from government to markets in 1990, now there's a little bit of a shift backwards to the nation state and government after the collapse of the markets in 2008. I think that's an opportunity for the social sector, education included.
Great, thank you. Well, a lot of fascinating points there for us to think about. I think this notion that there can be a lot of different institutions that create innovation and that having this kind of open source anarchy could be a positive with lots of organizations contributing global public goods, but with some architecture to organize it is important. And I think also your point about the fact that the vast majority of money that is spent on both health and education does come from countries themselves. So it does make sense for global investments to be in global public goods that support and make that spending more efficient. I think we would both agree that we haven't solved all of the problems of health. We're still working hard, but we think there are obviously also some big differences between health and education, which I'm sure we'll hear more about on the next panel. But I think hopefully we've shared a few ideas that might be useful to think about for the rest of this discussion, such as the fact that we need more evidence about what works, better impact assessment, more robust networks to translate knowledge globally, et cetera. And these could have the potential to actually be transformative in education the way they've been in health. So thank you so much, Ariel. I'm now going to introduce Jay Puckett, who's a senior partner and managing director at the Boston Consulting Group, and he's going to share preliminary findings for some research that looks at the global education ecosystem and what is already in existence and what is needed most. So thank you, Ariel, and welcome, Jay.
Thank you, Gina. I really appreciate the opportunity to be here today, and thank you to the Asia Society for hosting us. Gina and Ariel, thanks for sharing some of the ideas about global health. We need to learn as much as we can from the health sector about education, and ideas like open source anarchy are certainly sure to be on our list. Learning across sectors are going to be critical for us. We all know from just the newspapers and just living in this society that education is not where it needs to be. And as we've heard from Gina, she shared some of the stats and Tony shared some of the stats, but 57 million primary school-age children are out of school today, and half of those are in sub-Saharan Africa. Over 100 million young people worldwide lack basic literacy skills, with 60% of those being women. And the imperative for change is not just moral, it's also an economic imperative. 40% of businesses tell us that they're not getting the product out of education systems that they need to fill the jobs in their companies. And so as we look at the imperative for change, we get a serious call to action. And this impacts not just one country, but all countries. The picture of education is a troubling one, and the projections for the future are even more of a call to action. SDG 4 sets an ambitious goal for 2030 to ensure inclusive and quality education for all and promote lifelong learning. Yet when we look at the projections out to 2030, only 8% of young people in low-income countries are expected to have attained basic minimum secondary level skills. What's additionally alarming is if we look at the correlations on this page between educational attainment and income levels, we see a disturbing trend. Countries with lowest income have the lowest attainment levels, and this creates a vicious cycle for us. So you might think, well, maybe funding is going to flow to fix this problem. But as we look at the data on funding, what we see is that, and this is an example from multilateral donors, that we see a decline in educational funding. We see a decline in educational funding from 10% to 7% on a global basis, while physical infrastructure and health are increasing. And so we don't see funds flowing to this problem in the way that we might expect. And so there are many drivers behind this, but as we look to lessons learned from the Education Commission report, they highlighted a few factors that lead to this. First, it's more difficult, they would say, to prove the impact in education than it is in other sectors. And so just measuring impact is just harder. Secondly, the payoffs in education take longer to be realized. And so when you look to the political cycles, oftentimes people in political roles are looking at much shorter time cycles, and they're not paying attention to very long generational investments. And then thirdly, implementation inefficiencies and the lack of coordination of key stakeholders make investments in education comparatively less impactful than other sectors. And so these are contributing factors that cause investors to look at the sector and say, why should I put my money in this when I'm not sure that I'm going to get a return from it? So in light of the current state in education, there's growing consensus that we need to share more, right? We definitely need to look across borders and learn from one another. As we interviewed a number of global stakeholders, some of the things that we heard were education doesn't have the resources to duplicate its spend in every economy, right? We actually need, for efficiency's sake, to focus our spend on a global and regional level. Secondly, while there are promising practices that are clear, there's very little awareness around those, and there's very little implementation of those in different economies. We heard from somebody earlier today a metaphor about launching messages in a bottle and just hoping that they float to the right islands. And I thought that was an apt metaphor. And then other sectors like global health have attracted funding at a global level that's improved coordination and progress, just as Gina and Ariel pointed out. And so this convergence of beliefs has sparked a concerted effort. About a year ago, this effort started. We got involved a couple of months ago in this effort, and there are a series of questions that we're tackling. What's the current state of the global education ecosystem? What are the most needed global public goods? What infrastructure is needed to support these goods? And how can we measure their effectiveness? And so those are the kinds of questions that we're trying to tackle and building off the lessons like from the healthcare sector. And in order to tackle those, we've conducted a detailed survey, a series of expert interviews, some case studies from India, the US, and global health, and are also conducting a literature review. And we've had a broad range of stakeholders that have been involved already in this work, and we fully expect this list to grow substantially over time. And so, while this is very much a work in process at this point, I'd like to share with you today the 5 emerging trends that we're beginning to see as we look at this space. The first theme, and it's been highlighted already, but it's worth underlining once more, is the overwhelming consensus that there has been a significant underinvestment in the global education ecosystem. The second theme that's emerged from our conversations echoes some of what you heard from Gina and Ariel, that while global education can learn from successes in global health, there's some fundamental differences between the two sectors, and I spoke about some of those a minute ago around the funding issues. The third theme we've heard is that global public goods can have an outsized impact in advancing learning, especially in low and middle income countries. And that's encouraging, particularly given the educational attainment levels that we saw on some of the earlier materials. The fourth theme is that local capacity and global public goods need to work hand in hand. we need local capacity in order for global public goods to actually take hold in economies, and they have to work together. And then finally, and there was some discussion of networks in the last talk, there are good networks and effective networks, and there are poorly working networks. And the stakeholders pointed to some of the criteria that they see and the characteristics of high-performing networks. But we need those networks to work effectively in order to drive outcomes. Let me dive just a little deeper into each of these five. And Gina shared this same data, but we found it very compelling that only 3% of the global public good, 3% of the funding is spent on global public goods and education, while 21% spent on health care on global public goods. This begs the question, what can we learn from health? If they're spending a lot more than we're spending in education, what can we learn from health? First, we've heard that there are some points of similarity where education can borrow from health. Global policy advocacy is critical in both sectors. Globally comparable data sets are critical in both sectors. And then contextually relevant evidence is critical in both sectors. But it has to come from credible sources. But there are some differences that we need to be aware of too. For example, it's a lot harder to align on a definition for measuring success in education than in health. We saw some stats earlier about the number of deaths that were avoided. That's a pretty straightforward thing to measure in health. In education, one of the biggest challenges that we hear from businesses is that they want to see employees with social and emotional skills. And yet we don't have a simple way for measuring social and emotional learning as distinct from cognitive skills. And so it's pretty complex in comparison to look at that. In addition, while health has many interventions that depend on culture, there are some more universal elements of physiology in health that make a product or a treatment or a practice easier to scale. In education, the context and culture are relevant in almost every intervention. And then finally, the private sector has played a far more prevalent role in investing and funding R&D in health, and there are open questions about whether private industry will invest in education ever, really, in the same way that we see private investments in health. And so those are key ways that we have to be aware of the differences as we think about the application of global public goods. And then lastly, our conversations with global health experts have also surfaced some areas where health is grappling for answers, just as the education sector is grappling for answers. Most notably, both sectors have struggled to implement interventions that require continuous or complex behavior change. And so, as an example, if you're trying to get a student to show up for school every day, it may be similar to getting a family to use a bed net every night. But that's a more complicated behavior change to implement in either sector than, say, getting a one-time vaccine would be. And so realizing the complexity of getting complex behavior change to occur is a place that maybe education and health can work together. So what does this mean for education? There's a broad consensus that global public goods are critical to advancing learning, and most stakeholders highlighted three types of public goods as particularly important in low and middle income country context. First, we've heard the need for globally comparable data and standards in order to help track progress, identify priority areas, and drive accountability. An example of this comes from the PISA exam and from Brazil. In Brazil, in 2003, they had very low math outcomes for 15-year-olds. And this triggered, and some call it the PISA shock, this triggered action locally to set a goal that by 2021 they would achieve the OECD average in math scores. And in fact, that action has now translated by 2015 into an additional year of learning for the lowest performing students. And so we definitely see that when there is globally comparable data, it can trigger action and at a local level and cause people to mobilize. Another example is that the OECD has a PISA for Development program that's active in 8 low and middle income countries. But there are more than 100 countries that still haven't been reached, and an immense potential to capture by expanding coverage. So if you just think about the penetration of comparable data sets in those countries, it just really doesn't exist, or it's at a very low level of penetration. Secondly, we've heard that contextually relevant evidence base is needed to gain credibility from local actors and prove the effectiveness of interventions in highly different contexts. There are multiple examples that showcase this need for an evidence base that are drawn from a country's context, not only for reasons of effectiveness, but also for reasons of buy-in. And we know that if you take a Western idea and try to apply it in a developing economy, you're going to get organ rejection, right? And so we know that we have to make that a core part of what we look at here. A recent example comes from the work from JPAL, which has done great work in trying to take good ideas and transplant them into other countries in a contextually relevant fashion. In Kenya, they tried to apply a Western scholarship program that would increase penetration rates in 2 Kenyan districts, Busia and Teso. And the researchers that did this work showed that it worked in one of the districts, but it really didn't work in the other. And the conclusion was, you know, if we take something from one country, we have to make sure it's relevant. And even if we make it relevant in one part of a country, it still might not be relevant in another part of the same country. And so this example clearly highlights the importance of contextual relevance. And then finally, stakeholders highlighted the need for global advocacy campaigns around learning outcomes. And in the interest of time, I'm not going to share an example on that one because I know we have a big program. I will highlight another important concept that we've heard from all the stakeholder interviews that we've done, and that is the important linkage between creating global public goods and building local capacity. We know that if we just create a bunch of global public goods and put them on the shelf, that they're not going to get picked up by countries. And so we know that we have to build capacity at a local level so that they can even take advantage of global public goods. And so this linkage is a critical part of what we're observing and something that we're building into the next part of our work. The last idea, and there was discussion about this around health, is around the concept of effective networks. And around this circle, you'll see characteristics that we heard the stakeholders say were important to effective networks. And we looked for examples of effective networks. One example that we saw did come from the U.S. It was the Carnegie Math Pathways Network Improvement Communities. And this network identified that just 5% of developmental students who follow the traditional path achieve college math credit within 1 year, and 80% don't succeed even after 3 years. So it's a real failure point. But then they created this network where teachers and administrators worked together to define a new way of teaching developmental math. And when they worked together and they all bought into it, and they measured the outcomes, and they changed the way that they went about it, they created a network and a program called Math Pathways, and that now has served over 20,000 students since 2011, and it has 3 times the success rate in half the time on average with each kid. So it is achievable, but we have to have effective networks to get at that. And when we ask the global stakeholders about the effectiveness of networks on a global basis, they told us that most of the networks aren't actually operating in an effective way today. And so we know we need to learn from this circle of effective practices to build networks going forward. And so these 5 themes that have emerged from our work thus far also have raised a number of interesting questions. And so we're going to hear from WISE about a November convening, and we're going to continue the work that we're doing and report out again at the WISE convening in November in Doha. And we hope to see many of you there. But in the meantime, this is a work in process and an interim update on what we're learning. Thank you to the health sector, and thank you to all of you who have helped us build this work to this point so far.
However you can manage, yeah. Just steps over here.
To sit in or anywhere?
No, just leave that. Just this chair open here. I'll take that one.
I'll go sit over here. Thank you.
Good, thanks. Well, very stimulating set of presentations. I want to get right into a discussion of some of the things we've been hearing and some of the things we've perhaps been hearing in our previous meeting. I will ask you to look at your bios that you have at your seats for the full biographies of our panelists. I'll just mention that we have on our panel Wendy Kopp, who is the CEO and co-founder of Teach for America, Alice Albright, who is the CEO of the Global Partnership for Education, Ju Ho Lee, who is Education Commissioner from the Commission on Learning Generations, and also the former Minister of Education to the Republic of Korea, and is also a member of our Asia Society's Global Education Center and Council, and then also Dolores Dickson, who is Executive Director of Camfed in Ghana. Let me just dive right in here, and Wendy, let me start with you. You know, you've been involved with Teach for America in the United States in the sort of national ecosystem here in education, and then you turned 10 years after that to 10 years ago to the global stage around Teach for All. Can you give us some of the sort of differences that come from those different experiences you had, both from those experiences, but also if you could think a little bit about some of the things you were hearing in the meeting previous to this about what we're hearing about differences and characteristics of ecosystems. It'd be great, I think, to help our audience understand some of those things. Yeah.
Well, there's so much in there, but I'm excited to dive into that set of questions. I think, you know, I guess I came out of my experience at Teach for America feeling like the most important factor in success, in succeeding in education is essentially local leadership capacity. Like, in the end, this is going to be about whether you've got enough incredible local leaders driving at progress. But I also saw in the United States most of the investment was directly in like developing those local kind of leaders and local organizations, but there was a little bit of investment in fueling what I've come to call a national ecosystem, like a few organizations, 25 or 30. I mean, when I got started in the US, there was no national ecosystem, but it kind of grew up, and maybe 25, 30 organizations that ended up being this kind of connective tissue between local communities and helped all these local leaders learn from each other. So someone would innovate in one community, and pretty soon, folks all over the country would know, like, that was an innovation that worked. Let's think about whether we can adapt that here. So it was really interesting to move from that to the global space. And I guess two things struck me personally over time. One was really flew in the face of what I thought I would find. I mean, I started out thinking every context is so different. What are we going to have to share with the folks in India? The contexts are so different. And I was really very quickly just struck by how eerily similar the root causes of the issues that we're addressing in education are. And once you realize that, you realize actually there are not only remarkable similarities, but the silver lining in that is that we could be doing so much more to learn from each other across borders. So I was seeing that, but it was also having moved from this kind of national space where there was so much opportunity to learn from community to community to the global space where it just felt like, where's the learning infrastructure? How are we helping all these local folks learn from each other? So for me, I think that's kind of my frame in coming into this and saying, okay, we need to build a global ecosystem that helps local folks learn from each other. The only other thing I'll say in reaction to your question is I think we heard an incredible amount of really valuable feedback in this other room over here where we spent about 3 hours with about 50 folks kind of feeding back, in reaction to the, I think, incredible work that the BCG team has done alongside so many others over the last couple of months. And probably my biggest question coming out of that, and we have a lot of time now to synthesize, and we really haven't had a chance, and there are probably 50 different views of what the biggest learnings were from that private working session. But the thing I'm most questioning, one of the things that really struck a chord was this idea that, so much change in education is adaptive. And, is there an assumption when we call for a lot more global public goods that a lot of what we need to do is around technical change? And I guess what it's just really leading me to wonder, because I think it would be a pretty terrible unintended consequence if we saw lots of investment in global public goods that wasn't really married up, as the BCG team has kind of really highlighted, with efforts to build the capacity to actually utilize those global public goods. But it just makes me wonder if we should shift the frame entirely and say, let's invest in networks of local actors so that they can learn from each other and generate not only the cross-border sharing, but ultimately that is what will, from the ground up, create the global public goods that will kind of help accelerate progress, as well as the kind of strengthen local leadership capacity. And when I heard Gina speak about really her experience in health, it was so much about networks and that in turn generating the global public goods.
That's really interesting. I think that resonates certainly with our experience. We've for 5 years now generated something called the Global Cities Education Network, which is essentially a network of city education leaders that are together trying to find solutions to similar problems, but not just importing one from another, but really thinking through a methodology that actually uses improvement science as a way to kind of bottom up, share information and share the construction of knowledge that's potentially a solution to problems. So I think it's a very good point. Alice, let me come to you then and ask you, the Global Partnership for Education, you all have recently decided to kind of go all in and really invest heavily in global public goods. What was the rationale for that? What's behind that?
Well, thank you. Thank you for the question. And before I answer it, I think I want to step back and reflect a little bit about some of the differences that were alluded to earlier between the health space and the education space. I did work in the global health space for a number of years in the early 2000s, and I often think about what the differences are. I think that there's been some, very important data mentioned, particularly around financing. And we see stark differences between financing going into R&D for health versus R&D for education. And I think that one of the main things we have to remember, and it's incredibly tempting to say, well, one's just kind of like the other. It's actually quite different. In the health space, when I think about my time at Gavi, a significant part of the cost structure of what we were trying to do was actually developing and producing the vaccine. And that lent itself to a pretty efficient global public good type of approach. And then there was, of course, delivery cost, but the main cost was the cost of the vaccine. And then there was all kinds of very well-organized R&D processes around that, clinical trials processes. So the path forward was quite, not to say obvious, but it was clearer.
Yes.
Education is quite different. The global public good aspect of education is quite low compared to the cost of delivery, and it is a fundamental difference. Most of the cost in education is the cost of payroll, administration, and we're seeing at the moment precious little money going into actually what I would call the improvement agenda, which one might think about as R&D. So comparing those two things, which are in fact quite different, let me now get to why GPE started deploying money to this. At the moment, in any country that we would work in, and we work in at the moment in the 65 lowest income countries, about 70 to 80, sometimes 90% of education budgets are spent on payroll. It's a critical part, obviously, of the work that has to occur, and precious little of it is spent, and there isn't even funding for it to fund the improvement agenda. And when we looked at all that had to occur to try to begin to make progress on the equity agenda, the quality agenda, for example, we need to start looking at improvement. But the critical difference is we can't just invent a bunch of public goods and say, here.
Right.
Huge difference. You would know that, certainly from your work. You would know that from your work. Countries have to be in the driver's seat around establishing their own priorities, their own networks of who they want to work with, what curriculum choices they want to make. And so we have actually gone at the whole topic of global public goods creation with that in mind, which is it is not a bunch of people sitting around in places like Washington and New York and London and Paris and so forth. We have to go about it by putting countries in the driver's seat and saying, what are the problems that you have? What are the intellectual assets across the globe that might be made available to help you do it? You, by the way, may have many of your own solutions. So really the driver is more around knowledge identification and distribution rather than knowledge creation. And you asked, why did we get into this to begin with? It's first of all because it is creating a huge barrier, but we've designed it in such a way to really acknowledge what I've talked about, which is that we have to go about it in a completely different way than what the global health space has.
That's really interesting, yeah. To pick up on that then, Juholi, you all have made tremendous progress in Korea in education, made rapid progress. What was the role of global public goods in accelerating that progress?
I think there were three major pillars that has made Korean education world-class. The first one is rapid expansion with equity. The second one is linking education with economy. And third, promoting brain gains. So Korea has made basic education universal in just one generation, just starting from 1945 to 1979. Korea has made 9 years of education, all universal for every children. So, and then moved on to the high school education, and then university education. So Korea became the most highly educated nation, but it pursued progressive universalism. So first focus on basic education, and then move on to secondary, and then tertiary, so that the expansion is really equity-based. And second, Korea really made a balance between general and vocational, so that education become relevant for the economy. And third, in developing higher education, it really takes time. So Korea was really active in inviting those who went to abroad to study, come back and contribute. So these are really basic, simple basic principles, kind of principles that has made Korea successful in educational development. But when I was in Myanmar or Vietnam as a commissioner to share this Korean experience, it's kind of global public good, right? The experience that Korea has accumulated. But that is really simple principle, but it's not really easy to implement.
I can imagine.
Yeah, so that's why there is a lot of room to benefit from one country's experience for other country. Mm-hmm. So, and the Education Commission, through its initiative called Pioneer Country Initiative, has really been very productive in providing international public good.
Interesting, very interesting. Yeah. Then Dolores, let me turn to you. Then bring you into the conversation. You've been working in Ghana, much experience there. Can you share with us some of the examples of innovations that have actually occurred in Ghana that have been taken to scale, and I think we'd be particularly interested in what allowed that to happen.
Sure. Yeah, that's very interesting. So I would speak from my own experience and from Camfed. So Camfed supports girls from marginalized communities to get access into schools and be able to stay in school and complete. So we provide scholarships. And we've been doing this for a very long time in Ghana. And at one point, I think 2 years ago, the government decided that they wanted to focus on supporting improvements in secondary education. And because only about 30% of students from junior high are able to make the transition into secondary education. So they were looking at ways to expand access to secondary education and keep students in school. So they started this program called Secondary Education Improvement Project, and which included infrastructure, building more infrastructure, as well as creating opportunities for access. Now the question is, yes, there would be the seats in the school buildings. They would have the seats, the buildings will be there, but how do the children actually access those, especially children from poor families? How are they going to be able to afford the cost of education? And so we worked together with the government to design a scholarship program that would target children from very marginalized communities. And so based on what we had done previously and continue to do, we took those ideas to the government. We worked with them. We designed the targeting mechanism, the process for selection, the process for actually reaching out to them and keeping them in school. And Camfed's program is very holistic, so there were aspects of the program that were also adopted by the government. And this program is still ongoing, and it's targeting those marginalized groups. But what we realized was that even within the country context, there needed to be variations. There needed to be a way to look at this differently. So there were certain adjustments. For example, we work in very rural communities that are in the mainland, but this was going to target the whole country. And so it meant that they would have to look at children who are along the border of the country. And you know, Ghana is surrounded by French countries. And so the main thing was to look at supporting Ghanaian children to stay in school and get access. So there was a very simple change that was made to our program, which considered the nationality of the student, which is something we never considered because we were already working in the mainland, assuming every child was Ghanaian. But because they were targeting the border countries, border communities, they needed to consider whether that child is Ghanaian before they get onto the scholarship. So something as small as that was a difference, made a difference for the government's program, and this is a program that is still ongoing. And I think what makes it work, I think, is when there is a bigger agenda that is already there, and that innovation can support. But the government already had this agenda. They wanted to do this. There was the political will to do this. So it was a great opportunity to adopt something like this and use it to achieve what they wanted to do.
So it speaks to your point about having the local community, local country decide its own needs and so forth. Let me stick with you just for a second, Dolores, and ask you this. In your opinion, would it be helpful to Ghana to have more investment in building local capacity and bringing best practices from other countries? And what do you see as the biggest barriers to leveraging global resources and knowledge locally?
Yeah, I think it would be very beneficial. I know that there's been things that have come to Ghana from others, and we have a proverb that says that wisdom doesn't stay in one person's head. So you learn from people and you grow with that. So obviously it would be very beneficial. But the opportunities are there, but we need to also look at what are the possible barriers or challenges, as you said. I think one main thing that I think would be an opportunity is also see, really kind of tag this along with a bigger agenda. And if there is the agenda that is already there, there is the willpower for governments and local communities to really seize on these new ideas that are coming in and kind of use that. And then the second thing I would say is about flexibility. I think that sometimes we say that there is flexibility in this model, but we still feel that it has to be the same model. And I think that's just really creating that opportunity for that creativity and local knowledge and value to be embedded in these ideas is very important, and recognizing the value that local capacity already exists, that there are people in communities and people in countries who already have a lot of capacity and can really contribute to these ideas. Sometimes it's because the agenda is not at the right time, and that's why it might look like this is not something people are taking over. So I think we just need to recognize that the timing has to be right, the agenda has to be something people want to rally behind and are convinced that they want to, and recognize that there is capacity, so there's the opportunity for us to do.
Very good. Do you want to comment on that?
Can
It sounded like you
I
did,
ask
yeah.
Dolores one more question? Because I
Take
think
over.
this is a really interesting example. And I think you're bringing to life so clearly what we've seen as well in education, like things need to be so deeply contextualized. I'm curious, you're part of a larger, I don't know if you would say network, or certainly, network of Camfed organizations in other countries. And I wonder, to what extent being part of that and being able to learn from your colleagues and from the kind of global Camfed network or organization, to what extent did that end up influencing, like it had to be changed and adapted and all, but would it have had the same impact if you hadn't been able to learn, I guess, from those others?
I think the interesting thing about working in Camfed and working with so many other countries as well is we have weekly learning calls where we share our own experiences from our programming across our 5 countries. So we're always learning from each other, and we've adopted so many models from Zimbabwe, Zambia, Malawi into the Ghana context through our programming. And I think that we've always adopted them, but we've seen the good in some of those practices that have really helped us. Things we never thought about, things that we were coming from, like really innovative ideas. We had a transition program that we've started in Zimbabwe that is now working in Ghana, and we've adopted it to the Ghana context, and we're working with the government on this transition program. I think one thing about scale is if we have that relationship with governments, that's when we're able to scale a lot of these ideas as well. We can't just do 3 communities or 5 communities and expect to, if it's working in those communities, we have to have those conversations with government to see the possibilities of scale.
That's really interesting. You wanted to,
Yeah, I'd like to raise some Asian context to this discussion, because I think Wendy's framework of global education ecosystem also well applies to Asian education problem. In Korea, the most serious issue in education in Korea is transformation from rote learning and multiple choice tests toward learning based on horizontal learning and learn-to-learn type learning. So because Korean students do very well in PISA test, but PISA test mask a lot of important skills, 21st century skills, like collaboration, creativity, and so forth. So we really want to make a transformation in learning system, but Korea used to rely on a top-down approach through policies, relying on bureaucratic controls and so forth. But we increasingly think that that kind of top-down approach is not working very well in addressing those Asian education issues. So we probably since 5 or 10 years ago, we tried to adopt a more bottom-up approach or ecosystem approach so that stakeholders and teachers voluntarily try to find a way to change their pedagogies, and governments set aside and just provide information and so forth. And in those efforts, I think global public good idea is also very important, because we talk about PISA, but PISA is focusing too much on cognitive skills. So, for example, Asian countries, they do all well in PISA tests, but we do have problems. So maybe the international test balancing more on non-cognitive tests skills with cognitive tests is really necessary. But so that more work on those standards and global standards, and collecting more data, comparing other different countries. We really spend more on this global public goods.
I'm going to come to you for questions in just a minute, but I'm going to let Alice have the last comment on this part of the discussion.
Thank you. I just want to build a little bit on what Dolores has said and just take it a bit further. I think you've made a very important point about getting the balance right between understanding that there are certain things that we know across geographies. What might those be? One is that lower ratio of trained teachers to students is good. Reading in the language that you are used to is good. And there's certain things that we know are applicable almost in any geography. But we also know that the local context, the local receptivity to those types of changes, how they might be regulated, how they might be rolled out, is critical to whether or not those standards that we know are good are actually going to be well received and supported. So I think that balance you made is absolutely right. If you look at the education architecture, and this again carries the point further, the education architecture is remarkably fragmented. There's lots of organizations doing lots of things, financed in lots of different ways, and often it's stop-start, often it's quick fix, often it is parallel and separate from what the governments are looking to do, and often it is not financed in a way that can last very long. And so when you combine a fragmented financing landscape with an approach to public goods that may not take into consideration what the governments are looking to do and the local populations and local community, you can see that you need to approach this whole question in a very different way.
Yes, I think that's right.
And I think that's probably the main takeaway that I would have coming out of this. And it also, I think, would argue for making sure that you're also investing in local advocacy, local support, local networking, and all of the things that need to go alongside of what we're calling public goods to really aid in the receptivity.
I think one area that international public good approach is really important is drastic changes in education. I think we all agree that we need really fundamental changes in education, particularly in training teachers, because Korean experience really shows very well about this, because Korea has attracted top 1% students to teaching job, and we provide one of the best pension program for teachers, but still we fail to train them as good teachers. And they lost self-efficacy despite their good salaries, their respect, their excellence in subject areas, because the way we train teachers are really different from the way we teach doctors, for example. So we really focus more on practices and making teachers to care about every children one by one, and to analyze the problems of children and to provide best learning opportunities for everybody. Right? So we are thinking about really trying to make a drastic change in teacher college system, but that cannot be done by just one nation. Right? It must be pursued collectively, and maybe the international public goods approach is really, I think, necessary for this kind of.
No, absolutely. That certainly resonates with what we've gone all in on teacher development as what we do at Asia Society, because that very piece that you can't get there from here without that part of it being right. So I'm going to open it up to the audience here, and I also just want to mention that people watching on the webcast can submit questions via Twitter using the hashtag Asia Society Live. I'm going to ask Jeff Wong to kind of monitor those questions, and if you get a good one, holler, raise your hand. But let me first now then turn to the audience here in Asia Society. Go ahead, right here.
This is a great session. So this is a great session. My goodness, I have like 20 questions, but I'm going to focus on one.
That's a good idea.
Sure it's really productive and good, right? So I'll start with the question about the idea of international public goods being focused on outcomes specifically, like the minister said from Korea, which are related to soft skills. I'm wondering from the panel if you genuinely believe that soft skills can be measured, and if you do believe that, if you believe the psychometric assessments for them can scale internationally, because that would be the holy grail of being able to direct teachers to want to teach the skills of the future. And I'm wondering if you believe that's just so aspirational it's never going to happen, or if you believe it's something which could be a step in the direction of creating an international public good that's very actionable. Thanks.
Anybody want to take that?
Goodness. I think in the ideal world, I think that would be it would be very value added to be able to, first of all, agree on a definition of soft skills and agree on a definition that was, on the one hand, meaningful, but on the other hand, not so top down that it didn't take into consideration very genuine and valid differences to what one might think of a good soft skill might be. So I think as an aspiration, it's great. There's going to be a lot of steps that need to happen first to get there. And one of them, of course, is data collection. In many of the countries that Global Partnership for Education works in, we're still working at the very rudimentary aspects of data collection. So it might be quite a while before one gets to what you're talking about. But I do think that many people are beginning, you certainly talked about it, Minister, beginning to realize that just measuring the very sort of rote skills at this stage is probably not enough.
One example in Korea is English assessment. We used to test students just on listening and reading, but we added the ability of writing and speaking. It's testing communication skills rather than just memorizing through rote learning. So it's kind of gradual development toward better assessment, including softer skills. I don't see we can get the best assessment in 1 or 2 years, but maybe we can make efforts to get the ideal assessment system.
Yeah, and there is a lot of work going on in trying to think about how to assess social emotional learning. Yeah. And I think one of the things that people are realizing is that you may need to think about assessment more from a sort of performance base as opposed to something you do on a paper and pencil, that you actually observe people's behavior and infer whether or not they're being able to show empathy and communication skills and so forth. So there's a whole regimen, I think, of ways of thinking about assessment that might be able to get to that, but it still is, we're still early days in that as well, certainly. So, other questions? Here.
Hi there. I just want to kind of go back to the financing aspect and ask, is there something that we can learn from public health about domestic financing for education? Because we know already that the on-costs for education are the biggest proportion. In the Commission report, 97% of resources for education must come from domestic budgets. But we know that domestic budgets are quite small as it stands. And so is there anything that we know about how public health has increased the share of budgets going to health, something that we can learn for education? And maybe is there an opportunity for education and health to work together to increase the overall domestic budget?
I can talk about that.
Yeah.
You're absolutely right. The lion's share of resources for education do come from domestic budgets. One of the things that's core to our work is making sure that that continues. But I think we've got to think about the financing challenge for education quite differently. First of all, we need to make sure that the domestic resources going in education do not fall backwards and get replaced. But we also need to make the strongest possible case that we can make internationally about why we need more international resources going into education. And that needs to be a strong results narrative. It needs to be a strong narrative about how education is foundational to achieving all of the other SDGs, which I think everybody would agree with, the role that it plays in a much broader foreign policy debate, for example. And I think also change in some ways the expectations. One of the things that's quite different between at least the vaccine part of global health and education is that once you have a vaccine that works and has been proven to be efficacious and you know that it can be delivered, you can point to the number of children whose lives have been saved as a result of it year in, year out. Not that it's simple, but it is a short period of time. Educating children takes, I speak here under the minister's control, decades. And so we have to change the expectation that we can't go to any political cycle that we all might be involved in and say the result will be from this to that, quick fix, problem solved, and get people to think about the problem entirely differently. So I think that that's also part of what we need to fix.
As you may know, the Education Commission suggested that International Finance Facility for Education, IFED, and the G20 meeting, last G20 meeting in Hamburg decided to discuss IFFED on the next G20 meeting. So it's still an ongoing issue, and I think through IFFED, we can double the international aid on education, and that could really make a big difference. Mm-hmm. I think it's a kind of change maker. So as a minister, when you I'm telling my experience as a minister, if you really want to make a change, you need more money. So maybe international agency can provide more money. That could be really a big help for national education champion to make a real change in education.
We're going to wrap up this session with a comment from Wendy.
Well, I just couldn't resist the opportunity to jump on the Financing Commission too. I mean, first of all, yes, to everything that was just said, but I also think, very relevant to the discussion we've been having this afternoon is just to note that, I think it's just fascinating to think about the fact that the global funding, the global aid funding that goes into public health, 20% of it is focused in some way on essentially helping folks learn from each other across borders. I'm still trying to figure out where the 3% that they say does that in education funding goes. I'll take it for granted, but honestly, I can say from personal experience, it is exceedingly hard to find any of the $17 billion that is spent each year on global education that would go to fostering sharing of learning across borders. That funding goes to locals, and we need a lot more of it to these points, but we should spend a tiny fraction of the whole helping folks learn from each other so that, as in Dolores's case, all these local folks can lead all the more effectively because they're informed by others. I just think we can massively accelerate the pace of change if we make a tiny investment of the whole as they've done in health.
Yeah, can I just add one quick thing?
Yes.
I think the issue of financing, I think that recognizing that domestically, that's where the most financing is coming from. The government spend in Ghana about 90% of their budget on education, but there is also a private cost to education which parents and others have to take on. And so the cost of education funding is not just coming through the government, but there's also the private funding coming from parents. And for poor parents who just can't fund that, there is the need for us to look for innovative ways to encourage children to stay in school and to continue their education. And this is why for Camfed, working with communities, so that they find the solutions that best suit them, that's the most low cost and most cost effective to keep their children in school, is part of what we do. And so investing in global public goods and innovations like that can really help to manage the cost of education even at that level. We have a program where parents, we're actually quantifying the local philanthropy that parents put into education, which includes their time, which includes time in providing guidance and counseling and mentoring and support to children so that they can stay in school, because the cost of education is not just the direct cost to them, but also all these other things. So I think that this is something that investing in sharing best practices and learning can help to keep as many children in school as possible.
That's very important. Let me invite you to give a round of applause to our panel. Thank you very much. Stay here just for a second, might be easiest. And I'm going to ask Elyas Felfoul to come up and speak for just a minute. He is the Director of Policy Research and Partnerships at the World Innovation Summit for Education, known affectionately as WISE.
Slides.
Yeah, okay. So we have the screen for a couple slides, right quick. Maybe actually, I guess we do need to leave. I didn't realize we had slides. So while we get the slides together, we will empty the space for you.
Anyway, I need them for later anyway. So thank you for the panelists, first of all, and for the intervention, for a very insightful conversation. I will close with a quick update on some of the work that WISE has been doing with different partners. We have Teach for Brookings, Teach for All, Marathon, the Asia Society, BCG, Result for Development, among others. Like it was outlined in the beginning of the session, a number of organizations have been meeting and discussing how we can strengthen the global education ecosystem and improve the impact of global education actors to support the SDG goals. 4 targets. One of the things that has been decided upon was that there is need for further investigation to be conducted, which was led by several organizations. So the question that we focus on at WISE is, what is the global education ecosystem landscape, and what are the biggest gaps? We have started the work by defining a clear framework for thinking about the global education ecosystem. Indeed, one of the common issues in development is the terms used by different people in different organizations tend to refer to different things, which is there's a challenge of definition. So step one was to make sure that we identify a framework for thinking about the global education ecosystem that everyone agrees on. The second step is to actually map the ecosystem, which means looking at who are the actors, where are they, what do they do. Strengthening an ecosystem doesn't stop with a static mapping and tracking of the actors. We need a dynamic way to know what's happening, share knowledge, and enable collaboration. We want to significantly increase the circulation of knowledge products. To do this, we are very excited to bring our mapping and research into a partnership with Marathon, a platform built for education development. We have identified so far over 270 actors that Marathon will be mapping into their social graph platform. So I guess this is, gives you a sense of what's the platform look like. So Marathon will be a living community where actors can claim, build, and update profiles as easily as they do on Facebook or Twitter. This will be their home to post knowledge product and share across the graph. And this will, so Marathon will make it possible for the world education leaders to connect, collaborate, and share knowledge. It's not moving anymore. So users will also be getting personalized and newsletter based on their interest and organization they follow. This beautiful work will be launched at the WISE Summit in November, so we hope you check it out then. We believe this work is incredibly important as it will allow us to shed light on what is actually going on. This will also lead to more effective knowledge sharing and allow for stronger collaboration between global education actors, influencers, and global change makers. This is a work in progress, and we will be presenting the final product by Marathon and continue this conversation at the WISE Summit on 14 and 16 November in Doha, Qatar. For those who have never heard about WISE, we are the World Innovation Summit for Education. This is an initiative of Qatar Foundation. We are a multi-sectorial platform for creative, evidence-based thinking, debate, and purposeful action. We bring together about 2,000 delegates, 150 speakers from around the world to carry this conversation on how to tackle the education challenges of our time. And this year's summit theme is coexist, co-create, learning to live and work together. Sounds something. We hope to see many of you there and continue deepening this conversation together. As a summit, WISE has been thinking a lot about how to make conversation between global actors as relevant as possible, with the goal to lead to concrete actions. One of the things that we have realized is that a continuous conversation is needed in which the learning and outcome can be revisited and built upon. So this is why WISE will not stop this conversation at the summit, but we feel that it's very important that we take this as a movement to partner with different global education, economic, international development forums worldwide to be able to carry this conversation and contextualize and adapt it to the regional and local realities and environment. Anyway, we're very excited to do this work, and we look forward to keep this conversation and bring it to a much more impactful reality. Thank you very much.
Well, this has been an enormously stimulating session, and I think you can all tell that we are in the midst of a movement around an education ecosystem of which there's quite a bit more to think about and develop. And what we want to make sure that we do, though, is keep this conversation going, as Elyas just mentioned. So I just want to invite you all to continue to have your input and feedback on what we've been talking about. You can do that through social media via the hashtag Asia Society Live. I think we have it up on the screen here. And also by email at edevents@asiasociety.org. So please use those to continue this discussion. And with that, I'll just ask you, I'll say again to you, thank you very much for your comments, your questions, your attention, and look forward to seeing you again here at Asia Society again at some point soon. Thank you very much.